If a woman has come in and she's in menopause and she's having really bothersome hot flashes and night sweats, and know that 75% of women who go through menopause are going to have hot flashes and night sweats, and they last a really long time too. So the mean duration of hot flashes and night sweats is 9 years. And it starts before you actually have your last period, and it goes on for a while. And recently we found out that up to 1/3 of women are going to have moderate to severe hot flashes for 10 years or more. So this is going on for a long time. So when we sit with women in our offices, we really have to figure out what's going to work for this person. And it may be just a short time, but she may be one of those women that has symptoms for a longer period of time. So hormone therapy is the most effective treatment for hot flashes and night sweats. The most effective treatment. It works in at least 90% of the time, and I would argue it's probably more than that if you pick the right woman. But for those women who can't use hormone therapy for one reason or another, they don't want to, they have a history of breast cancer, they've got some reason why they can't take it, we have some other options. And first, we start with lifestyle changes, as with everybody. Even those on hormone therapy, the lifestyle changes are still important. And those include maintaining a healthy weight, regular exercise, stress management techniques like Tai Chi and yoga, a Pilates class, maybe meditation. Acupuncture has been shown to be somewhat helpful in women, even getting a massage, so working on stress management. We know that any medication that we use has a high placebo rate. Now what that means is for all those trials out there for treatments for menopause, if you give a woman a sugar pill, she's going to get about 30% better just with the sugar pill. So whatever treatment we use has to be better than that to be effective. So the treatments that we use are things like SSRIs and SNRIs. Those are antidepressants, and those have been shown to help with about 40 to 50% reduction in symptoms. So we're over the placebo rate, but we're not anywhere close to what estrogen would have done. But for those women who are suffering from hot flashes and night sweats and need some help, these are good options, and they're usually used in low doses. Another option would be gabapentin, and that medication is used also for migraines and for seizures and for pain. But we found out that it helps with hot flashes in low doses. And also for those women who are having a sleep disturbance, sometimes just taking a sleep aid can help them get through the night. It's not going to do anything for the night sweats and hot flashes, but it can help you sleep through them. Some women will notice that they have triggers for hot flashes and night sweats. For instance, eating warm or spicy foods or drinking a warm or caffeinated beverage can be a trigger. So avoiding those, it doesn't mean that you can't ever have caffeine, but it means that if you have a couple of cups of coffee, you might notice a few more symptoms. Alcohol and tobacco are also triggers. And we recommend that women dress in layers so they can take a few layers off when they start sweating, and then they can put it back on when they get cold again. We think that that temperature zone where they feel comfortable just narrows a little bit to where you get hot more easily, and then you turn around and get cold right after that. So the same thing for nighttime, using light clothing during the evening, during night, and using bed covers that you can take off, using a fan, using a cool pack for under your pillow might be helpful. So all of those things can help you feel better. Some of the over-the-counter products that are advertised for management of symptoms during this time frame include soy. A recent study came out about a year ago that unfortunately didn't show any real efficacy to soy, but nonetheless some women think it's helpful, and it's probably not going to be harmful, especially if there is no history of breast cancer. In breast cancer patients, we generally recommend that it be avoided, even though to date there really hasn't been a study suggesting that it worsens your chances for a recurrence if you've had it. Another thing would be black cohosh, and that one we actually don't recommend. Not only has it been found to not be helpful, it's associated with a few cases of liver failure, and so we recommend that women stay away from that one. Unfortunately, there is still great fear about hormones. I think some of that is unwarranted, and I think we've come back around on our thinking with hormone therapy to realize that for most women in their 50s who are symptomatic, who are having a hard time, that hormones really are okay to use, and for most women they're safe. So if you're having those really, really bothersome hot flashes and night sweats and mood swings and you can't sleep and you can't concentrate and you wake up in the morning and you don't know how you're going to get through the day, hormone therapy is highly effective for those symptoms. For women with a uterus, you consider estrogen, and you must take the progesterone with it, or progestogen, which is a generic category of progesterone. It contains synthetic and the bioidentical progesterone. For women without a uterus, you can just take estrogen alone, and you don't have to worry about a progestin with it. So it's very, very nice in that situation.